Okay. Good day, distinguished educators, students, researchers, and professionals in early childhood education. This is day 36 of our 90-day structures professional series on early childhood behavior, environment, and learning. The topic of today is so important, and the title is Torama Inform Early Childhood Education, Supporting Children with Invisible Wounds. I am Dr. Bashir Ali Muhammad, and as I told you that this is the 36th of our 90-day structures professional series on early childhood education, behavior, environment, and learning. Let me begin with a serious and compassionate questions. When a child reacts strongly or withdraws suddenly or behaves unpredictably, could there be a story we do not see? Yes, actually, there must be a story that we do not see. Today's message is both Pam and human. Some children are not misbehaving. Some children are copying. Believe you me, some children are not misbehaving. They are copying from their younger brothers and sisters living there together. Early childhood education, or to say, the early childhood educators must understand the principle of Torah inform, the Torah inform practice, the Torah inform practice, abbreviated as TIP, tip. So we have to understand this tip, Torah inform practice, because Torah is not always visible. The trauma in children, even in the adult, is not always visible. Past, what is trauma in early childhood education? Or to say in childhood? Trauma refers to overwhelming experiences that exceed a child's ability to cope. This may include domestic instability, abuse or neglect, loss of loved one, community violence, displacement, chronic poverty stress, severe illness, and emotional neglect. Young children do not always express trauma verbally. Instead, trauma may appear as aggression, withdrawal, hypervigilance, emotional outbursts, fearfulness, overreaction to minor triggers. Children used to respond hotly when they are in trauma. So we must understand all this. Behavior becomes a language of distress. Number two, trauma activities. Number two, trauma affects the brain. Trauma activates the survival system of the brain. When a child feels unsafe, the brain prioritizes protection, not learning. It used to what? To prioritize protection, not learning. So there is need for every child to be safe and protected if we want learning to take place. In this state, attention decreases, memory weakens, emotional reaction intensify, impulse control also decline. This is not a defiance, it's what? It's as a result of trauma that affecting the child. It is neurological survival response. If we misinterpret trauma, if we if we misinterpret trauma responses as intentional misconduct, we risk worsening the condition. Professional educators must differentiate between deliberate behavior and stress response. You have to be very careful while trying to understand how your child responses, because we have to differentiate that of the deliberate behavior and that of the stress response. Number three, trauma informed classroom practice, that is TIF. Trauma informed classroom practice. Trauma informed teaching does not mean lowering standards. It means strengthening support. The key practice includes: number one, are predictable routines. The structure creates safety. Anything that was informed before the time, so that things created safety in it. Calm tune. Clarity reduces anxiety. If you want to talk to your children or you want to talk to your pupils, you have to calm your tune so that they will understand you clearly. Number three, emotional validation. Acknowledge feeling without endorsing harmful behavior. You have to acknowledge how that child is feeling, not just translate them negatively. Private correction. Avoid public embarrassment. The children need privacy. If you want to teach them or correct them, you have to do that privately. Number six, strong relationship. Connection builds resilience. As a teacher, you have to connect yourself with the children. If you didn't connect yourself with the children, you are not going to get what you wanted to get from them. If you need their attention, they won't offer you their attention. So we have to strong our relationship. Safety is the foundation of learning. Safety is the foundation of learning. If children are feeling unsecured, they will not learn. They will not pay attention to learn. We must ensure a safety environment for learning. A practical illustration for today's topic: imagine a, imagine a child who reacts aggressively to loud noise. Instead of punishment alone, consider the following things. Was the noise a trigger? Does the child associate loud voice with fear? A trauma-informed response will look like this: lower volume, offer reassurance, teach calm technique, teach calming technique, maintain boundaries calmly. Fairness remain, but empathy guides you. Understanding improves outcomes. Number 4, balancing compassion and authority. We ought to balance the compassion with authority. Number 4, balancing compassion and authority. Trauma-informed practice does not eliminate discipline. It strengthens discipline through understanding. Children still require number 1, clear rules, consistent consequences, accountability. The children, they like this. But correction must be calm, not reactive. Compassion without structure creates instability. Structure without compassion creates fear. Balance builds safety. So we have to balance our reactions and activities. Reflection for educators. Ask yourself as usual, do I assume misbehavior or seek understanding? Do I maintain predictable routine? Do I model calm regulations? Do I build strong individual connection? Professional educators respond, not react. Understanding context reduces escalation. We can apply this tomorrow to see a wonderful changes. Observe one child who shows intense reaction. Ask, is there a pattern? What triggers the reaction? What caused the reaction? What makes the child to behave in such a way? How can I adjust environment slightly? Because environment is subject to change. We can modify and change the environment slightly. Bit by bit, the environment will be conducive for learning. Introduce one supportive strategy, a calm down space, a visual routine chart, a brief emotional check-in. Small adjustment may produce a significant improvement. Small adjustment may produce a significant improvement. A deeper insight for today's topic, children exposed to trauma require stability more than punishment. A single consistent adult can change a child trajectory. Early childhood education can be retroactive. We cannot erase trauma, but we can provide safety. Safety strengthens resilience. Resilience restores confidence. Confidence improves learning. In conclusion, trauma-informed teaching protects dignity while maintaining order. Tomorrow, we move into another foundational topic, classroom rules that actually work, designing structure that builds responsibility. I remain Dr.